The World Health Organization reported this fall on research that found consuming meat, especially cured and processed cuts, to be a major factor for causing cancer. We asked Dr. Wilson Mertens, Vice President and Medical Director for Cancer Services at the Baystate Regional Cancer Program, to give us his perspective on the issue.
I do believe that the data is correct, that the preponderance of evidence shows that cancer incidence is reproducibly increased by consuming processed meats. I think where the disconnect occurs is that calling something a carcinogen evokes a different concept in different people. For the epidemiologist, for people in this work, yes, there is evidence this is associated strongly as a causative agent for cancer. For you and me, when I hear a class 1 carcinogen, I imagine that people are going to be exposed to something and there's going to be a significant rate of death. And to put this in perspective, the rate at which colon cancer is associated with processed meats in terms of the estimated increased risk is about 1.2, so a 20% increase. Compare that to tobacco and lung cancer, which is a 15 to 25 times risk. So when you look at the epidemiologist's tool, which is the odds ratio, this is a relatively modest but statistically provable point.
Is it fair to say, with your experience, what you see, and you're involved in both medical care and following a lot of the research and involved in that, Americans, excuse me, in particular, are real offenders and in particular danger for cancer, our lifestyle. We eat a lot of processed foods. That means a lot of sodium, lots of sugars, chemical preservatives, and dyes.
It's true, and we've not been successful in really significantly altering that. And I think there's a lot of cultural reasons for that. Some of it's economic. If you have socially isolated and economically challenged families who can feed their family much more economically getting fast food as compared to going to the supermarket and buying foods that would constitute the National Cancer Institute recommendations for a balanced diet, that's going to be a challenge to alter the diet. And we still have large numbers of individuals in America still using tobacco on a daily basis, where the rate of cancer causation is several-fold greater than almost anything else we can think of.
Let me get into some of the particulars of the WHO report and other reports like this. The American Institute for Cancer Research says, and I believe this pretty much echoes the more recent WHO report, 50 grams of processed meat a day, they say that's about the size of an average or small hot dog, equals an 18% increase in your risk for colorectal cancer. That seems pretty striking.
It does, but you have to kind of put it in perspective in other ways. So let's say that the risk of developing colon cancer in people who don't use any processed meats at all and controlling for all other factors is 1. You add this risk of processed meats, and it goes up to 1.18. Suddenly, the number doesn't seem quite as impressive. If you look at lung cancer and the risk of developing lung cancer, controlling for all other factors in non-smokers is 1, and then you add in tobacco and daily usage, and it goes up to 20. That's a much bigger increase. So there's no doubt that there's an association. I don't believe the WHO report really was structured to try and clearly define the extent of risk. That's really hard to do with these studies. What they were really designed to do is look at a lot of epidemiologic studies and evaluate, is there a consistent pattern that we can use to attribute causation? And I think the 18%, while I think that's a reasonable number, I don't know that that's really the extent of the risk.
On the other side of the coin, American Institute for Cancer Research said they believe, and research they believe has shown, consuming a pound of hamburger a week, they consider that a moderate consumption of red meat. They don't see it associated with a notable colorectal cancer increase. And again, I guess we're talking the real processed meats versus a more natural product.
Correct. I think part of that may be that it's easier to get a sense of consumption of processed meats. How these studies are performed really does affect the data. Imagine taking a group of patients who do not have an exposure and a group that does, and then trying to retrospectively get a sense of, well, what was that exposure? For example, if you had a concern of cancer in a particular community and you worried about the drinking water, you'd try to have a group of folks not associated with the drinking water, not associated with the exposure, look at their specific cancer risk, and then the population with the exposure and see if there's a difference. Well, the challenge is, well, for that particular study, who lived in that area? You know, did you live there your whole life? Did you just move there? What if you moved away? So evaluating the amount of exposure is a big challenge. And I think that does make the data just a little bit more complicated to evaluate.
Before we started taping, I know you said you got to look at this kind of common sensibly, and people aren't sitting down eating a half a pound of bacon 3 meals a day, whereas maybe they are having 2 or 3 strips of bacon, 2, maybe 3 breakfasts a week. That's a big difference.
True, but on the other hand, you know, the same amount of exposure is 2 slices of processed meat in your sandwich. So if you have a sandwich a day, that's a kind of a daily exposure. I think that the common sense approach is to say yes. There's no doubt that there's going to be associations between our diet in the Western world and many cancers, as there is an association between diet elsewhere in the world and other cancers. But in terms of colorectal cancer, the good news is that the incidence and the mortality of colorectal cancer has dropped year on year since the mid-1970s, undoubtedly due to colon screening, early detection of polyps, actually primary prevention. So while this is a concern and people need to be commonsensical in terms of the diet that they consume and be moderate in terms of most things, this is probably not the biggest impact. When the Center for Global Health Burden tried to take this data and extrapolate and impute, well, how many lives globally did we lose from processed meats? They came up with a number of 34,000. That's quite a large number annually, but that's in the context of over 8 million dying of cancer across the world. What's the impact of tobacco? Well, it's not 34,000, it's over 1 million. What's the impact of alcohol? Well, it's not 34,000, it's 500,000. So we are managing risk in our lives all the time. I think in order to avoid cancer incidence, the key things we need to do as a priority in our society is, again, keep the focus on tobacco consumption, limit alcohol consumption, try and have a more balanced diet. I don't believe it's going to be very easy for most people in this country to achieve what's been recommended in national guidelines, but try to improve the consumption of fruits and vegetables. I think it's reasonable to limit consumption of processed foods. In fact, the WHO has kind of walked back some of their comments, and they made the suggestion that, well, they didn't really recommend not to eat processed foods, which is a little different from saying, well, we didn't make a recommendation not to stop smoking. I think that there's a balance there, and I think they're recognizing that perhaps the phraseology of a class 1 carcinogen, which means something to them but something different to us, was probably unwise and needed a little bit of nuance at their initial release.
Well, Dr. Wilson Mertens, thanks for coming in and putting some of that nuance and perspective on this report for us. Appreciate it, sir.
Very much. Thanks, Jim.